You are lying in bed. It is the middle of the night. The house is completely silent. You are finally drifting into that deep, restorative sleep you have been craving all day. You are comfortable, you are safe, and then, zap, it hits you out of nowhere. It feels like a high-voltage lightning bolt just struck the base of your big toe. It is violent. It makes you jerk your entire leg back instinctively, tangling yourself in the sheets. You wake up instantly, heart pounding in your chest, gasping for air. You scramble to sit up and look at your foot, expecting to see a bite mark, a cut, or something broken. But there is nothing there, just the lingering, vibrating echo of that sharp electric stab. And then the fear sets in. If you are over 55, your mind probably races to one specific word immediately: gout. It is the classic old-timers complaint. Maybe your father had it and walked with a cane because of it. Maybe your friends at the coffee shop complain about it. It is the boogeyman of foot pain. So, naturally, you start spiraling. You start thinking about uric acid. You start mentally cataloging every single thing you ate for dinner. Was it the steak? Was it that glass of wine? You start planning to throw away half the food in your fridge. You might even stumble to the bathroom cabinet looking for leftover painkillers or anti-inflammatories. But listen to me very closely, because this is where 90% of people make a mistake that costs them months of agony. There is a massive chance you are completely wrong. There is a silent epidemic among people over 50 that mimics gout perfectly, but has absolutely nothing to do with what you eat or how much water you drink. If that pain is actually a pinched nerve, a mechanical wiring issue originating way up in your lower back, and you treat it like gout, you are making a critical, perhaps irreversible error. Think about the consequences. If you treat a nerve issue as gout, you are loading your body with heavy chemicals it does not need. You are stressing your kidneys, which, let's be honest, we need to protect fiercely at this age, forcing them to filter strong medications for a disease you do not have. You are altering your diet, cutting out healthy proteins you might actually need for muscle maintenance, all for nothing. On the flip side, the danger is even worse. If it is actually gout, a chemical crystallization in the joint, and you try to treat it like a nerve problem by stretching, pulling, and massaging that toe, you are going to grind microscopic, razor-sharp crystals into your delicate cartilage. You will turn a temporary flare-up into permanent joint erosion. You could be accelerating arthritis by 10 years in a single week. You have to get this right. The treatment for one is the absolute poison for the other. Before you swallow a single pill, before you try a single stretch, and before you call your doctor in a panic, you need to know exactly what is happening inside that foot. In this video, we are going to do something your doctor often doesn't have the time to do during a 10-minute appointment. We are going to decode the specific language of your pain. We are going to look at the 3 S's: the sensation, the scene, and the schedule. And most importantly, I am going to teach you a 10-second diagnostic trick using a simple household object, a standard yellow pencil, that acts as a tiebreaker. It is a neurological hack that can tell you, with surprising accuracy, whether your foot is suffering from a chemical attack or a wiring failure. I will walk you through exactly how to perform this pencil test at the end of this video so you walk away with a clear answer. But first, we have to talk about the feeling itself. Your body is screaming at you, but we need to figure out if it is screaming in chemistry or mechanics. Let's start with the sensation. We need to distinguish between the broken glass and the sniper shot. When we talk about gout, we are talking about chemistry. We are talking about a buildup of pressure within a confined space. A study published in the journal Arthritis Care and Research surveyed patients describing their gout flares, and the words they used were visceral. They didn't say uncomfortable, they said crushing. People who have a full-blown gout attack rarely describe it as a quick shock that comes and goes. They describe it as a siege. It feels like someone took a glass bottle, smashed it with a hammer, and then shoved the jagged shards right into the socket of your big toe joint. And then, and this is the key, they left it there. Gout throbs. It has a heartbeat. It is constant. It is a relentless, pounding pressure that mimics your own pulse. Boom, boom, boom. It doesn't care if you are moving or sitting still. It is there. When you have gout, the worst enemy you have in the entire world is your own bedsheet. I want you to think about that for a second. Even the weight of a high thread count thin cotton sheet touching that toe feels like a sledgehammer blow. You might find yourself doing what we call the blanket tent. You lie in bed and construct a little fortress with your pillows and blankets just to elevate the fabric so it hovers over your foot without touching it. You are terrified of even a breeze hitting it. That is the hallmark of chemical inflammation. The sensor is turned up to maximum volume and it is stuck there. Now I want you to contrast that vividly with the zinger. This is the pinched nerve. Usually, this problem starts way up in your lower back, specifically the L4 or L5 vertebrae. But here is the trick. You might not feel a single thing in your back. Your back might feel great, but the signal is traveling down the wire and exploding in your foot. This pain is not a throb. It is a sniper shot. It is clean, sharp, and terrifyingly fast. It feels like an electric fence. You take a step and zap, it shoots through the toe. Then, just as quickly, it vanishes. You stand there waiting for the next one, but it's gone. You take another step and nothing. You relax. Then you twist to grab your coffee and zap, it hits you again. It is unpredictable. It shoots, it stabs, and then it retreats. This is a wiring problem. It is mechanics. It is a connection issue. Here is a massive clue that you can check right now. Does the pain travel? Gout is a squatter. It stays put. It sits in that big toe joint and it cooks. It doesn't move up your leg. It doesn't shoot into your heel. It anchors itself in that one specific knuckle and sets it on fire. Nerve pain, on the other hand, is a traveler. It has a passport. If you feel a line of heat, a buzz of electricity, or a sensation like running water trickling up your shin or buzzing around your ankle bone, stop thinking about gout immediately. Gout does not travel up your leg. That traveling sensation is a distress signal coming from the sciatic nerve bundle. That is a map of your wiring system lighting up. I want to pause here because this distinction is vital. Think about your daily life. When you are driving your car and you press the gas pedal, do you feel a sudden shoot of pain into the toe? That is likely the position of your leg compressing the nerve. When you are sitting in your favorite recliner watching the news, does the toe start to buzz? That is the chair pushing on your spine. Gout doesn't care about your chair. Gout hurts just as bad whether you are standing, sitting, or doing a handstand. Right now, you might be thinking, okay, that makes sense, but I still can't tell 100%. It hurts a lot, and I don't know if it's throbbing or zapping. It just hurts. That is completely normal. Pain is confusing. It clouds our judgment. It makes us panic. Doctors have expensive, time-consuming ways to figure this out. They can order blood panels to check your uric acid levels. They can put you in a claustrophobic MRI machine for 45 minutes to look at the discs in your spine. Those tests take weeks to schedule, and they cost a fortune in copays. But you don't need that yet. There is a way to get a very clear answer right now, sitting in your chair, without spending a dime. There is a simple diagnostic trick you can do with a standard yellow pencil. It relies on a neurological principle called sensory discrimination. It takes about 10 seconds to do. It is surprisingly accurate at distinguishing between a joint that is chemically inflamed and a nerve that is dying or compressed. I am going to walk you through this pencil test step by step at the very end of this video. It is going to give you a binary answer, yes or no, so you can stop guessing and start fixing it. But before we test the sensation, we have to look at the scene of the crime. We have to use our eyes. There is a visual red flag that almost everyone ignores because they are too focused on the pain. I want you to take your sock off right now. Put your reading glasses on if you need them. We need to inspect that toe like a detective. Gout is not subtle. It is not a silent ninja. It is a bomb. It is an explosion of inflammation. Because it is a chemical reaction where crystals are physically tearing into tissue, it creates massive amounts of heat and fluid. Look at the skin around the big toe joint. Is it red? And when I say red, I don't mean a polite rosy pink. I mean angry, shiny, fire engine red, or even a deep bruised purple. Does the skin look tight? We call this the angry apple look. The skin looks stretched, waxy, and shiny, like a balloon that has been overinflated and is ready to pop. You lose the wrinkles in your knuckle because the swelling has pushed them out. If you see that, if your toe looks like a shiny red plum, you are almost certainly dealing with gout. Now look at the pinched nerve toe. It usually looks completely normal. That is what makes nerve pain so incredibly frustrating and psychologically draining. You are in agony. You feel like your toe is being electrocuted every 30 seconds. But you look at it and it looks innocent. It isn't swollen. It isn't red. It looks exactly like your other foot. In fact, if you touch it, it might even feel cold compared to your other foot. This is the major distinction that you need to memorize. Gout is visible volume. Nerve pain is invisible signal. If your toe looks normal, no redness, no swelling, no shiny skin, but it is screaming in pain, your problem is likely not in your foot at all. It is in your lower back. You are chasing a ghost in your toe when the problem is in your spine. You could soak that foot in ice water for a week and it won't stop the pain because the signal isn't starting there. Here is a quick check you can do right now. Gently hover your hand over the painful joint. Don't touch it yet. If it is gout, touching it will hurt. Just get close, like you are checking a radiator to see if it's on. If you can feel heat radiating off that toe without even touching it, if it feels like a little heater, lean heavily towards gout. Inflammation generates heat. If it feels room temperature, or if it feels clammy and cool, think nerve. Nerves control blood flow. When a nerve is pinched, it can actually constrict the blood vessels, making the foot feel cold. So hot equals gout. Cold equals nerve. Now let's talk about the clock, the why now trigger. Why does this always seem to happen at 2 a.m.? If it is gout, the timing is not a coincidence. It is not bad luck. It is simple physics. Uric acid is a waste product floating around in your blood. It is a byproduct of breaking down foods containing purines. When your body is warm and moving during the day, your blood is pumping fast. Your circulation is robust. That uric acid stays liquid. It stays dissolved in your blood, just flowing along. But when you go to sleep, your physiology changes. Your heart rate slows down to its resting pace. Your body temperature drops to conserve energy. And your feet, being the furthest thing from your heart, get the coldest. They are the end of the line for circulation. I want you to visualize making a glass of iced tea. If you put a spoonful of sugar into hot tea, what happens? It dissolves instantly. It vanishes. But if you put that same spoonful of sugar into ice-cold tea, what happens? It doesn't dissolve. It crunches to the bottom. It crystallizes. That is exactly what is happening inside your toe joint at 2 a.m. As your feet get cold, the uric acid turns from a liquid into sharp, microscopic, needle-like crystals. These crystals settle in the joint, and they are sharp. They poke the lining of the joint. That is what wakes you up. This is why, for some people, simply wearing warm wool socks to bed can actually help prevent an attack. It isn't a cure, but it keeps the joint warm enough to keep the acid liquid. Now contrast that with the nerve issue. If your pain hits you in the middle of a walk, or while you're sitting at lunch, or while you're driving, that is less likely to be gout. Gout doesn't usually flare up suddenly because you walked a block. Nerve pain does. That is a mechanical trigger. You moved, you pinched the wire, and you felt the zap. But the 2 a.m. wake-up call, that specific middle-of-the-night assault, that is the temperature drop. That is the chemistry set in your toe reacting to the cold. So let's say your toe looks normal. It's not red. It's not hot. But it hurts like crazy. And maybe it happens when you're sitting in your chair or standing in line at the grocery store. If the pencil test, which we are getting to in just a moment, confirms it's a nerve, you need to stop treating the foot. The foot is the victim. The criminal is in your back. We need to talk about the L5 nerve root. This is the specific wire that causes the big toe drop and big toe pain. It exits your spine right around your belt line. It runs down through your buttock, down the side of your leg, wraps across the top of your foot, and ends right in the big toe. It is one long continuous wire. If you sit all day, maybe you're retired and you spend a lot of time reading, watching TV, or on the computer, you are kinking that hose. Imagine a garden hose with water running through it. If you step on the hose near the faucet, the water stops coming out the end. When you step off, it sprays violently. That spray is the pain you feel. The kink usually happens in two places. First, the lower back. If you slouch, you compress the disc, which bites the nerve. Second, the wallet trap. This is huge for men. If you sit with a thick wallet in your back pocket, you are pressing directly on the sciatic nerve. You are physically crushing the wire for hours at a time. It creates a condition called piriformis syndrome, which mimics sciatica. It could also be your shoes. This is the fashion trap. If you wear shoes with a narrow toe box where the front of the shoe comes to a point, you might be squeezing the nerves between the toes. This is often called Morton's neuroma. While Morton's usually happens between the third and fourth toe, tight shoes can compress the digital nerves to the big toe too. Here is how you tell the difference with a simple action. If you take off your shoe and massage the arch of your foot, or rub your lower back, or do a gentle hamstring stretch, and the toe pain changes or stops, that is a nerve. You physically unkinked the hose. You changed the mechanics and the signal changed. If you have gout and you try to massage that foot, you will see stars. You cannot massage gout away. Massage makes gout scream. Massage makes nerve pain sigh with relief. So, what do? We need clear, actionable solutions for both. If you have decided this is a nerve issue, the zinger, you do not need pills. Ibuprofen won't fix a pinched hose. You need to floss the nerve. This is a concept that most people have never heard of, but it is standard practice in physical therapy. Nerves are not like muscles. You cannot stretch them. If you pull on a nerve like a rubber band, it gets angry. It snaps back. It causes more pain. Instead, nerves need to glide. They are supposed to slide back and forth inside a little protective tunnel in your leg. Sometimes, due to inflammation or sitting too much, that nerve gets stuck to the muscle tissue. It gets glued down. We call this nerve flossing. I want you to try this right now. You can do it sitting down. Sit in a chair with good, tall posture. Do not slouch. Slump your neck down, bringing your chin to your chest. At the same time, extend your painful leg straight out in front of you. Now, pull your toes back toward your nose. Hold for 1 second. Then, lift your head up to look at the ceiling and simultaneously point your toe down like a ballerina. Safety warning. Stop immediately if you feel sharp pain, intense tingling, or dizziness. Consult your clinician if you have balance issues or recent back surgery. This should not hurt. Do this gently. You are not trying to rip the nerve loose, you are coaxing it. Repeat this 5 to 10 times. This movement pulls the nerve through the tunnel one way, then the other. It clears the jam, it lubricates the sheath. For many people, this simple motion can stop that electric shock feeling instantly because it frees the wire. Now, what if it is the broken glass? What if it is gout? You need to dilute the tank. Remember the iced tea analogy? The sugar crystallizes because the liquid is too concentrated. You need to add volume to the glass to dissolve that sugar back into liquid. You have probably heard of tart cherry juice. In fact, studies from Northumbria University have shown that tart cherry juice concentrate can lower uric acid levels and reduce inflammation. It works because it contains anthocyanins, which are powerful antioxidants. But while cherry juice is great, plain water is the heavy lifter here. You cannot flush a toilet with a thimble of water. You cannot clear uric acid with a single cup of coffee. Here is the strategy. You need to hyperhydrate. Drink a large glass of water right now. But here is the trick. Squeeze a lemon slice into it. Why lemon? It seems counterintuitive because lemons are acidic, right? But once metabolized by your body, lemon juice actually has an alkalizing effect. It provides citrates. Citrates can help prevent uric acid crystals from forming and can help dissolve the ones that are there. You aren't just hydrating, you are chemically rinsing the joint. You are raising the river level so the jagged rocks are covered again. And here is the insider tip regarding diet. Everyone talks about steak and beer, but the hidden killer is fructose, high fructose corn syrup. A major study involving thousands of participants showed that men who consumed 2 or more sugary soft drinks a day had an 85% higher risk of gout than those who drank less than 1 a month. Fructose spikes uric acid faster than a hamburger does. So, if you are having a flare-up, putting down the soda pop or the sweet fruit juice, other than cherry, is more important than putting down the steak knife. Okay, we have looked at the skin, we have checked the heat, we have looked at the timing, we have talked about the flossing and the flushing. Now we need to close the loop. I promised you the pencil test. This is the tiebreaker. This is the moment of truth. This test works because of a fundamental difference in biology. Gout affects the joint, pain, but the nerves are usually working perfectly fine. A pinched nerve affects the signal, sensation. Grab a standard pencil with an eraser. If you don't have one, your finger will do, but the eraser is better because it has a specific texture. Sit down and close your eyes. This is important. You need to block out visual distractions. I want you to take the eraser end of the pencil. If you can't reach your toe comfortably, ask a spouse or a friend to do this for you. Lightly touch the eraser to the very tip of your big toe. Just a gentle tap. Then touch it to the ball of your foot. Then touch it to the shin. Ask yourself one question. What does that eraser feel like? If you feel the touch clearly, sharply, and it feels exactly like rubber touching skin, but you still have deep throbbing pain inside the toe, that is likely gout. Why? Because with gout, your neurology is intact. The wiring is perfect. The sensor is working. It's just that the house is on fire. You can feel the texture of the eraser perfectly well, even though the joint hurts. However, if the eraser feels dull, if it feels fuzzy, if it feels like you're wearing a thick cotton sock even though you are barefoot, or if you can barely feel it at all, that is numbness. That is paresthesia. Gout does not cause numbness. Gout causes hypersensitivity. Gout makes everything feel too much. If you have pain plus numbness, that weird dead leg or cotton sock feeling, that is nerve damage. That is a pinched nerve. That is your confirmation. The signal is being blocked somewhere upstream. This distinction is massive. You can have excruciating pain and numbness at the same time. That is the paradox of a pinched nerve. The brain is confused because it's getting a static signal, so it interprets it as pain, but the actual touch sensation is gone. So, let's wrap this up with your battle plan. Is your toe red, hot, shiny, and throbbing? Does it hurt more at night? Does the pencil eraser feel sharp and clear on your skin? Flush the system. It is gout. Drink the water with lemon. Get the tart cherry juice. Cut the sugar. Keep the foot warm at night. And see your doctor for a uric acid test. Is your toe normal looking, perhaps cold? Does the pain zap like electricity and move around? Does the pencil eraser feel fuzzy or dull? Floss the nerve. It is a pinched nerve. Do the slump stretch I showed you. Check your shoes. Are they too tight? Check your wallet. Is it in your back pocket? And stop treating it with ice, because that will just make the nerve stiffer. Don't guess. Your kidneys and your joints are counting on you to get this right. The medical system is great, but it moves slowly. You live in your body 24/7. You are the best observer of these symptoms. Now, if the pencil test confirmed it is a nerve issue, remember what I said. The problem isn't in your toe. It's in your lower back. You need to fix the root cause, or that zap is going to keep coming back, and it might get worse. I have a specific routine that targets the L5 vertebrae to open up that space and take the pressure off the nerve. It's gentle, you can do it on your bed, and it's safer than standard yoga. Tap the video on the screen right now called the single best stretch to open your lumbar spine. It is the exact movement you need to take pressure off that L5 nerve so the zapping stops for good. I'll see you there.